Good job. Your numbers are excellent. I'm really proud of you. I know that you've been trying hard and you've been sticking to that diet that we talked about. Thank you for doing that. Your numbers weren't as good as I'd like them to be, but you're going to keep sticking with this diet that we talked about, and you're going to try harder and you're going to do better the next time I see you. Your heart rate and your blood pressure were much better this time. You're looking good, and keep up the good work. Your blood pressure could be a little bit lower. I don't want anything to happen to you, so we're going to need to work on that diet and the exercise that we talked about. Bring those numbers back down to normal for the next time that I see you, okay? Great job. Your cholesterol is so much better. It's great. Those numbers are perfect. You've been staying away from those desserts, and you're looking great. Thank you for keeping up the good job. Your cholesterol numbers are a little bit high. I don't want anything to happen to you, so you need to work on that diet, the exercise that we talked about, and the next time that I see you, your cholesterol level is going to be down. Okay, your blood sugar numbers are looking a lot better. You still need to work on doing that exercise that we talked about. Remember, you want to take that fasting blood sugar when you're supposed to in the morning, and your numbers should be under 120, so you want to watch for that. Make sure that you're continuing to watch your foods and watch the amount of carbohydrates that you're getting each day. Okay, your blood sugars are getting up higher, okay, and I'm getting concerned about you. We talked about you fasting, about watching your carbohydrates. Remember that fruit and even carrots can contain carbohydrates, so you want to watch that in your diet. When you see the endocrinologist, he's going to know whether you've been sticking with this diet or not. So you really need to follow the foods that we talked about in the past. Your blood pressure is looking good, and I can tell that you've been following that diet that we talked about. You really need to lower your salt and make sure that you're staying along the dietary restrictions that we talked about. Please stay away from junk foods, stay away from any fried foods, and you're going to stay on this path, and then hopefully the next time I see you, you're going to remember not to eat too much salt, and you'll do better. Your blood pressure is really getting up there. I'm starting to get nervous about you. I don't think that you're following the dietary plan that we talked about. You need to lower your salt. You need to watch the amount of junk food that you're getting. Maybe a food diary would be the best thing for you, because I don't think that you're aware of what you're eating. Your cholesterol numbers are good. You need to stay on that diet that we talked about. Those omega-3s with the spinach and the broccoli, I hope that you've been eating those. That is starting to reflect in your numbers. Please stay away from that junk food. Only once in a blue moon can you splurge. Stay away from anything fried, and you need to really keep working hard at this so that the next time I see you, your numbers are going to be just as good. Your cholesterol numbers are getting a little higher. I'm thinking that you are not doing the diet that we talked about. You need to look for foods that have the omega-3 in it. Do the fish oil capsules. That's an easy way to get that in your system to help bring those numbers down. Your blood sugars are very high. I've talked to you about diabetic neuropathy. You said you have numbness in your toes and you're starting to lose feeling in your fingers. I really don't want to have to see you get surgery for this. Your blood sugar numbers are much better than they have been. I'm happy to see that. I hope you didn't fast too long to get them there. You still need to exercise. You still need to follow that diet that we talked about, and you need to watch the amount of carbs, or you're going to end up right back where you were 2 weeks ago. Your blood pressure is so much higher this time. I'm really worried about you. I do not want to have to see you in that ER. You do not want to have a stroke, and then you're going to lose control of your face, and you're not going to be able to talk anymore. You need to change your diet so that doesn't happen to you. Your cholesterol numbers are much better than they have been, but I think that you could do better. You need to keep exercising. You need to keep up with those omega-3s. Maybe take that fish capsule that we talked about. Your cholesterol numbers are so high. I do not want to see you in here with a heart attack. It feels like an elephant sitting on your chest, and it's going to be one of the worst pains that you have ever felt in your life, and it's going to happen before you know it.